Okay, so thank you for joining webinar. This is Ogawa from Tokyo, Japan. I'd like to talk about radiotherapy for keloids. So I have organized SCA and keloid specialized clinics since 2006. Now new patients of number is 2,000 in a year. So this is keloids, sometimes caused by piercing, injury, burn, and surgery. And this is hypertrophic scars. Actually, inflammation of hypertrophic scar is smaller than keloid. So this is histopathology of hypertrophic scar tissues. Inflammation can be found in the reticular dermis. Also, this is keloid tissue. Also epidermis and papillary layer of dermis, the inflammation is very limited. And mainly, inflammation can be found reticular dermis. So it is suggested that hypertrophic scars keloids are inflammation of dermis, reticular dermis. Actually, the difference about hypertrophic scars keloids are difference of strength and duration of inflammation of the dermis. So important things is that there are favorite sites of keloids. And these sites are frequently stretched or subjected to high stretching tension. So this is computer simulation of skin stretch. When we stretch skin horizontally, the high tension area lies on the edge of keloid because stiffness of keloid is hard, so cannot release tension. So adjacent skin, the tension increase. So please compare to the clinical appearance. The inflammatory region is completely matched with high tension area. So high tension is an important risk factor of keloid. So for clinical meaning, it is important to release tension. So sometimes we use Z plus D to release tension. So immediately after surgery, zigzag line wound is produced. And 3 months after surgery, please look at horizontal wound. Inflammation has already gone. And 6 months after surgery, 1 year after surgery, tension released and inflammation decreased. So actually, keloid looks like burning house, strong inflammation. And the repeating stretching looks like adding fuel to the fire. So our treatment modalities are, there are many modalities, from mild treatment to strong treatment, including radiation. So sometimes such kind of strongly burning house should be treated by operation and radiotherapy. And the inflammation once decreased, we should change to the mild modalities. So actually, the keloids and hypertrophic scar is an inflammation, not tumor. So steroid works. So target should be reticular dermis, deep layer of the dermis. And the steroid is injected, inflammation decrease little by little. So the size of keloid is small, we can treat by steroid injection. And especially in Japan, we can use very strong steroid tape. This is very effective treatment. Every day patients have to change the tape. But for children, the weak steroid tape would be fine because skin thickness is not so thick. But adult patients, the strong eclaplaster, the Diprodon propionate should be a first choice. And such kind of minor keloids can be treated by steroid tape only. I'd like to move to the talk about radiation monotherapy. This is very strong modality to decrease inflammation of keloids. We have used mainly beta ray, electron beam, but sometimes we have used brachytherapy, gamma ray. Actually, beta ray is easy to adjust the depths, and after penetrating dermis, the immediately decrease the dose, so it is clearly safe. So beta ray is a primary choice for keloid in Japan, and we have used protector and bolus to adjust thickness. And sometimes for incisional wound, we have used external brachytherapy. This is primary radiotherapy. we have used 25 gray 5 fraction for 5 days. But please look at the clinical cases. After radiation, color was firstly changed. This means number of blood vessels decrease, and inflammation decrease, and scar height decrease, and maturation is accelerated. 18 months after treatment, it became completely mature scar. This is also inflammation completely decreased and changed to mature scars. This is also peripheral area. The high tension area, inflammation is strong, so treated by radiotherapy, just peripheral area. This is another case. But the sicker keloids cannot be treated by radiation monotherapy because the radiation dose should be increased. So in that case, postoperative radiotherapy would be better. So before 2002, we have used 15 gray unified protocol. But total recurrence rate is around 30%. This is an acceptable result. So we have changed since 2003. And we have optimized the customized dose protocol, and the high tension area was treated by increased dose, 20 gray, and the yellow was decreased to 10 gray. And in the result, the total recurrence rate decreased to the 12%. And this is the most recent protocol. We have changed and optimized little by little the protocol. And now, anterior chest wall scapula upper arm high tension area is treated by 18 gray 3 fraction 3 days. And the yellow is treated by 8 gray 1 fraction 1 day. And other regions are treated by 15 gray 2 fraction 2 days. For example, if the surgery is performed Wednesday, the radiation started Thursday. And for example, 3 fraction 3 days in case the radiation is performed Thursday, Friday, and Monday. So actually, we have considered biological effective dose. In case of keloid, alpha beta seems to be 10, and there is an evidence that the risk of carcinogenesis is low when we set BD to less than 30 gray. So BD 30 gray equal 20 gray 4 fraction 4 days and 18 gray 3 fraction 3 days. So high tension area was treated by 18 gray 3 fraction 3 days in recent years. And this is questionnaire against radiation oncologists. So actually, the attitude of radiation oncologists to treat keloid is different by regions. For example, there are a big difference between Europe and North America. So Japan, North America, 90% of radiation oncologists accept keloid treatment using radiotherapy, but just 50% of European oncologists accept the keloid treatment using radiotherapy. Also, we have discussed the risk and the side effect of radiotherapy for keloids. In conclusion, we have concluded we should avoid it in children and infants, and we should avoid it in thyroid and mammary glands area. So I'd like to share my cases. The simple suture and radiotherapy. They remove everything and tension is removed and radiotherapy was performed. This is chest wall surgery and remove everything and sutured and radiotherapy. And sometimes we have used W-plasty and Z-plasty to release tension. The tension is released and radiotherapy was performed 18 months after surgery, 2 years after surgery, similar case. And this case was also surgical keloid, surgical scar. Keloids are removed everything and Z-plasty is performed and 18 months after surgery. And this is also scapular keloids, 18 months after surgery and radiotherapy. And such kind of sick keloids are a good indication of surgery and postoperative radiotherapy. And this is VCG vaccination keloid. Tension is released and radiotherapy was performed. This is trauma keloids. Remove everything and Z-plasty and radiotherapy. 2 years after surgery. Long linear incision should be segmented. And sometimes local flap has been used for huge keloids. This is keloids started from folliculitis, not burn cases. Folliculitis keloids. The contractured area is replaced by skin flap, and the margin is irradiated. And you can realize range of motion was improved completely. And this is a elbow joint and the chest wall. This is another case. This is the keloids, severe keloids with multiple diabetic ulcers. So now we can conclude keloids and hypertrophic scars can now be cured completely, because such kind of severe cases, they remove everything and the flap is raised and release tension, and the radiotherapy was performed. So please look at this. Range of motion improved a lot. And sometimes core excision method was used for specific region, including cartilage part of auricle. The just core is excised because keloid is an inflammation of reticular dermis, so just reticular dermis is removed, and suture softly, and radiotherapy was performed. So we don't need to cut ear, just the core is excised, and skin flap is turned back to the backside and sutured, and radiotherapy was performed. So there are no recurrence 18 months after surgery. And the wedge excision can be used for earlobe. Such kind of big piercing keloid, cut, and suture, and radiotherapy. This case was treated by postoperative radiation 10 grade to fraction 2 days. This is another case. So now in Japan, main treatment for scars is a control of tension and inflammation. So primary choice is steroid tape and plaster. If it doesn't work, surgery and radiotherapy is the second choice. So we should know even severe keloids can now be cured completely, mainly using surgery, radiation, and steroid tape plaster. And on a case-by-case basis, silicone gel, seeds, tape, steroid injection, lasers, ointment, and makeup therapy are selected. So we have a lot of cases. So we always welcome visitors from all over the world. So if you are interested in, please stop by Tokyo and let's discuss about keloid treatment. Thank you very much.